first up on the agenda, we are going to consider an act on staff recommendation to adopt amended findings and decision for the Lawson request for a variance from Health Code Regulation 1, wastewater treatment and disposal systems. And Anna, you're going to give a preview.
Well, could I just first say that we're sorry we made the mistake of not getting the date and this sent out right. It did cost a lot of extra work. However, in that process of extra work, I think we came out with a better situation. So thank you for that, Anna.
Yep, you're welcome. And thank you to Gina, and I think Gina can cover what we need to talk about. I don't think I need to give much of a preview, but I'm happy to jump in as you see necessary, so just let me know what you need from me.
Yes, jump in as you see necessary as well. Gina Miller. Am I spelling my name for Julie? Is that Jeannamiller? So, as Ellen said, we apologize for taking valuable staff and board time, but I'll try to at least make the presentation pretty quick. So, some of you who were at the hearing in July will remember that Bill Lawson, his attorney and his consultant were here. They heard Jim present.
I don't think his attorney was here.
Oh, Wayne was not here?
No.
I apologize. Okay, his consultant, Steve Kilbreth. That variance was kind of unique in that they asked for two very distinct variances from the health code. The board approved one and denied the other. And then the board adopted the findings of fact, conclusions of law, and decision as proposed by staff with no changes on that day. So that's not new and exciting. But the health code requires very specific timelines after somebody applies for a variance. The staff complied with all of those dates leading up to July 19th hearing. But the reason we're here today is really because of what happened after the hearing. The health code, the last step is within 15 days of that date. Staff send the applicant a final copy of the decision. That didn't happen. And we were made aware of that on September 19th when the department received, I believe it was addressed to Ellen, a letter from the applicant's attorney letting us know about that oversight. And he felt that his client did not have constructive notice of the decision, and that would possibly impede any further action that they wanted to take. So shortly after that, on October 1st, the department, through Anna, responded and described our plan to do what we're doing today, which is amend the decision that was finalized in July. And we'll go through the changes. Frankly, they're pretty minor, mostly date changes as far as deadlines by which they had to execute a use agreement and deconstruct a space on the property. Once it seemed that the applicant and his attorney were agreeable to that plan, we followed the notice requirements as set forth in the health code again. So on the 4th, we notified the applicant and adjacent property owners that we were having this hearing today. We put public notice in the Missoulian. We amended the staff report, and we sent it again to the applicant, his attorney, and his consultant. And then most recently, I think I saw it out there, I sent a memo yesterday about a meeting that was requested by Mr. Lawson and his attorney, Wayne Kapp. And that meeting was held, I think, at noon yesterday. Shannon was there, myself and Anna, as well as Mr. Lawson and his attorney.
Tuesday.
It was Tuesday. I lose track of days. Sorry about that. And the purpose of that meeting was to finalize the language in that use agreement that was one of the conditional requirements of the original decision. The applicants wanted a little bit more detail about what they had to do to comply with the decision and deconstruct a space. And I'll talk more specifically about that in a couple slides. The executed use agreement should be recorded by this point. I do have a book and page reference, and I think that it's in your packet. Yes, I can see it. So here are the 3 ways that the original decision will be changed. There's a date reference in the beginning that will be corrected. Some of you may remember that originally the hearing was slated for June, and the applicant canceled that, and we held it the next month in July. That didn't get changed in the decision. There's also a paragraph in there that reflects our oversight. We recognize that we did not comply with the requirements of the code, and so this is what we're doing to fix it. And then paragraphs A and B of the variance decision section will change to move some of the requirement deadlines down the road a little bit to the end of November. And we will go through those more specifically. So these are really the two conditions in the decision section. Originally, the deadline to execute this use agreement for the detached garage that had some living space that was plumbed, including a bathroom on the second floor. The original deadline for that use agreement was August 31st, and we've moved that to November 30th. That's already happened, so that's good. And then the second thing described what the applicants had to do physically to deconstruct the space by August 31st. The bold is not, I added the bold. That's not actually in the proposed amended decision that you have in front of you. That's just to draw attention to it. That's really what the applicant wanted more specific information about and is reflected in the use agreement. He just wanted to know what exactly he had to do. So we talked a lot yesterday, about how the water enters the building, how the water leaves, and what's acceptable to both parties as far as deconstruction. And again, I'll just reiterate what Ellen has said. I apologize for the oversight. We rely pretty heavily on a checklist to make sure that we hit those dates. And the final sending of the final decision wasn't on that checklist. It is now. So lesson learned, and we don't want to take up too much more of your time. So I'm happy to answer any questions you may have.
Any questions from the board? Do we have a list of proposed motions today? No.
Oh, I'm
Gotcha. Sorry.
It's also in the amended memo. Yes.
I know that's in a very good place for you to be able to see it. Behind your head.
I probably won't make it, so.
So I would recommend that the board adopt the amended findings of fact, conclusions of law, and decision as proposed by the staff.
Any board or staff questions on the motion? Any public questions or comments on the motion? All those in favor, signal with aye.
Aye.
Opposed? Motion carries. Thank
I'm
you.
going to send that right away after you sign it. I will send it today.
Okay.
Thank you.
Thank you. Next on the agenda is a motion to close. Someone can make a motion to close the session to discuss litigation strategy.
I will make the motion to close the session.
Second. No public comments on that. All those in favor? Aye. Opposed? Motion carries.
Or get over the name of that club. I just,
That's quite well.
fools owned. So perfect.
Are we back on? We're ready, okay.
Okay, I would move that we direct the county attorney's office on behalf of the Board of Health to file a stay in this case with the court.
Okay, we have a motion on the floor. Any board or staff comments on the motion?
Is that the right language? File
Request.
request.
Okay. Any public comments? Seeing none. All those in favor, signal with aye.
Aye.
Those opposed? Motion carries.
Thanks.
Thanks, Matt. Thank you.
Thank you.
Anna had asked me to give you guys a brief update on the Cedar Lake Sewer District litigation. Okay, so where do I start? I think since your last meeting, the Judge Townsend denied Don Larson's motion for a preliminary injunction. The court found that contrary to what Mr. Larson had claimed, that he is not going to he didn't necessarily prove that he was going to succeed on the merits of his claim, such that everything to do with the sewer project needed to be put on hold until the lawsuit was resolved. Judge Townsend denied that request. And at the same time that she was denying that request, he filed an amended complaint. He'd originally filed a complaint in June. He filed an amended complaint at the end of August. And it's not only him as the plaintiff anymore. There's 30-some other Seeley Lake residents who are plaintiffs now. And they didn't add any new legal challenges. They added a couple of facts about a meeting in September, but otherwise the complaint was exactly the same as what they filed back in June. Missoula County has now been served with that amended complaint, and we have to respond to it by the end of November. The Seeley Lake Sewer District has also been served with the complaint, and they being a separate government entity, our office doesn't represent them. They are represented by the Beal Law Firm and John Beal. And John Beal filed a motion to dismiss the complaint a week ago. And essentially what John's arguing is that under no set of facts that have been alleged by Mr. Larson or others, do they have a legal right to the remedy that they're asking for, which is to delay or stop the Seeley Lake Sewer District from going forward. Mr. Larson's attorney will have to respond to that before the end of this month, and then we being Missoula County and the county commissioners will probably join in that motion to dismiss when we have to appear in late November, and we'll see what happens there. Motions to dismiss are very, very rarely granted, but in this circumstance, I think John Beal made a fairly compelling argument that there just is not, for a variety of reasons, a legal basis for the court to do what the Larsons and the other plaintiffs wanted to do. Does anybody have any questions on that?
I would just add that
Oh, right.
at the meeting that the Seeley Lake Sewer Board held in September, they did vote. There were only 3 board members present, but all 3 voted unanimously to have Great West continue with the documents that are needed to go to bid to 90%, so they go to bid at the end of January, beginning of February. So they basically are moving forward. Now, if you saw the article in the Missoulian, the chair still thinks she hasn't made that decision. I will remind them tonight that they did make that decision. And then John Hart also shared with me just some of the language that their attorney, Mr. Beal, has used, saying that the board has basically obligated itself, the previous board, some of which are still there, after the legal process that was required in regard to sewer districts, they obligated themselves by passing a resolution, which this board tried to change. I take my Cracker Jacks lottery with me when I go, and I told them they couldn't change it because it was, it was telling the story of what had happened. So tonight they will be meeting again, but they did vote to go forward. So that's expending a lot of money to get a company to complete the drawings to 90%. They asked some really good questions. I mean, it's always hard to come up to speed when you're new to a process that's been going on for years and years and years. So, I mean, part of it is if you look at where the sewer district will be served in the first 4 phases, there's a lot of Seeley Lake that's not in it. And some of it is adjacent to what's going to be served in phases 1 and 2. And so some other questions were, can they add it on so we serve them in the future, because that makes sense. And of course they can. They would have to put larger pump stations and things, but it'll all fit. And so I think that helped them to go forward. So we'll see how they go tonight. They also will see whether they can come up with one board member's already resigned that was elected in May, so they need to, their bylaws say they appoint their own replacement, and there's 2 names tonight, and three of them can agree to at least pick a name out of a hat and accept that person. There may be a new board member, otherwise they might just be going forward with 4 for a while. See? In my quote in the paper, I really didn't say I was going to a sewage meeting, Sealy sewage meeting. I said sewer meeting. It's still, apparently I get the best quote of the year, so.
Is
All right.
it
Thank you.
accurate that the resigned member has joined the amended lawsuit?
Yes.
Thank you.
She's now a plaintiff.
Right, and one of the people putting their name forth for the board was on the amended lawsuit and asked the judge to take his name off so he could run for the board.
Oh,
So it's
okay.
always complicated.
Fun times in Sealy tonight.
Thank you.
Thank you.
Could I say one thing too about this? I just want to say that I think Jean Curtis is making a huge difference at those meetings. Those meetings were amazing. I have never seen meetings run the way that these meetings have been run, and it really has changed over time. And they look to Jean for advice about how to move forward. And I think you're having a huge impact there. So thank you. Thanks so much.
Next up on the agenda, Ellen.
Vicky's here?
Yeah, it's time.
All right.
Great time.
Well, I neglected to find out, come on up, Vicki. I told you last month that Vicki Dundas, who has been with us, and this is what I didn't, 20 years?
18.
18 years. Wow. Wow. And has served mostly in supervisory roles and has moved up in those roles through just so many issues, and actually a whole generation of mothers and children in the community. Is retiring on Halloween.
Yes. That was a good day.
There will be a reception in the morning. We will get the invitation to you, but I just wanted to take this moment to honor Vicki, thank her for all of that work, much of which is unsung. She also had the pain of leading her staff through the biggest cuts that have ever been brought down, and fighting those cuts, and also keeping staff as, able to move forward as possible. So I thank you for that. And I just wanted to give her a chance to talk to you, or you to her.
Thanks, Vicki.
Thank you so much. I really appreciated everything you guys have done, all your support, the commissioners and the board, through 18 years of...
18 years of.
Well, it's been a wild ride. Like I told Ellen, it seems like wherever I fit in, we immediately had all these things happen. Within a month or two of... I worked a year in home visiting, and then I started in on the clinic supervisor position. And within a few months of that, 9/11 hit. And so we had all this federal money then for public health emergency preparedness. And that's when we were giving smallpox vaccines in the clinic,
Craziness.
anthrax vaccine, or potentially, and then H1N1.
Mhm.
So we did all those mass clinics, and then a flu vaccine shortage. And then I moved over to home visiting about 8 years ago, and we immediately had, which was wonderful, Affordable Care Act dollars for home visiting for the first time ever, really, to have that kind of funding. So it's just been so interesting and so exciting, and my passion for maternal child health will always be there. It's not going away, just time to find a different venue.
And then you've done so much recently with the refugee work again.
The refugee families, yeah, so.
Missoula County is losing one of its moms and aunties, and think of all the people that you've touched.
Thousands. My staff have touched thousands of people. We get about 4,000 referrals a year, so. And I think the trend, really is becoming more competitive, more private nonprofits are kind of getting into. For a while, we were the only game in town, and it just isn't true anymore. We have lots of competition. Now we have to step up our game a little bit, and it's just time for new energy. I'm pretty tired and worn out. But we have a lot of really wonderful staff that I'm hoping, might step up to the plate and with new energy, a new focus, because it really is a new world for public health now. We cannot let anybody forget what public health nurses do, or social workers, and dietitians. And it would be really easy to with the competitiveness now. The competitive grants are tough. So I think that would be a good focus moving forward. We know that we'll have your guys' support. Anna's been great, just like that, whenever we need her. Random questions. So, thank you guys so much.
Thank you.
Thank you guys have been really good.
Hope you have a good future.
Thank you, yeah.
Maybe we
You'll
can sell
find
a
a
beach
place.
together.
I think you and I could still probably make a difference in Missoula.
Especially when you don't have to behave, right? Just
Yeah, when we
what
don't
you
have to
do.
behave and we don't.
Insert ourselves where needed.
I think that's a good idea. We'll have to have a glass of wine.
All right.
Thanks so much.
Thank you.
Item 6, Julie, we're gonna skip, those are minutes.
You do have the September 5 minutes, but
Sorry.
That's just a compilation of strategic planning, so they're rather
They were
summarized.
emailed.
they
Oh,
were
is that-
in
is
the
that
packet
this
last
document?
night. Yeah.
Okay. Yeah. The one that says strategic planning, draft records and proceedings.
Right, okay.
It doesn't say minutes on the top, but.
Yeah. I remember. It's a long one.
We tried to just provide a general overview of what took place at that meeting so that we can submit that information when we apply for reaccreditation.
I would move that we approve the draft record of proceedings from our strategic planning meeting of September 5th.
I'm sorry, I have one change.
Okay.
I'm on the Board of Health. As much as I love James Stevens, and my husband's name is James Stevens, you put him down as James Armstrong.
Oh, yes, sorry about that. Thank you, thank you.
Good catch.
Well, it was a wild meeting, so lots of energy.
You could have just done it with photos of the proceedings.
Yes.
Okay, I changed my motion to say as amended.
Any board comments on the motion? Any public comments? All those in favor, signify. Aye. Opposed? Motion carries. Next up, Helen, adopt 2019-21 strategic plan.
Right, so you have two pieces and two different agenda items and two different motions that appear to relate to each other fairly well in year one. So you have the strategic plan, mission, vision, guiding principles, the now 4 areas of priorities, adding that 4th area of community relations and branding, and the 3-year goals. With every attempt to make them as measurable as we could. Goals are rather directional, so sometimes making them measurable, we had to do it with timelines or dates. So that's what's in front of you, and then this would stand as adopted for 3 years, as our work plans change each year. So I'll just limit my comments to the overall 3-year plan at this point and recommend it to the board to adopt.
So are you ready?
Yeah, go ahead.
So on the strategic work plan, something that we've been trying to work with the county, I mean, you've got to have measurable goals, but to me, it would be really helpful to say we're going to do this and what do we expect the public health outcome to be? So, for example, there's one in here, we're going to mail 1,000 postcards or something. What do we think is going to happen because of that? All right, so if you look at goal 3, so page 3.
So you're on the work plan,
I'm on
right?
the work plan, yeah. You can look at it first then. Because I can't find my notes that I wrote on the other one.
Okay.
So it says that we're going to enter, try to increase WIC to 50%, so goal 3. And yet, when we had the strategic planning, we talked about that nationwide WIC is going down. So is that realistic? And, and then if you look at objective 2, talking about teen vaccines and knowing that there is that competition out there, are we the right entity? Or are families using family practice docs, or, and should we focus on public health and vaccine and changing the law to make people enter stuff in a vaccine registry instead, so that we know that people are, can we reach that goal in a different way, I guess is what I'm wondering on that one.
Yeah, on that specific one though, Jean, I did read this as an overall community, not here.
Okay. Is that true?
Is the chip?
Well,
How do we know that?
I'm sorry, but I
Yeah.
did miss the
Reading the words
discussion
wrong
on that, and that Sarah is not here with us today. However, this one actually does appear to be on the people we serve. We do have, and this is a department strategic, we do have a larger problem that we've talked about both with the state and with this board and among ourselves, that we don't know except by estimates what the community-wide rates are. And I do agree that the changing the law for the registry, which has been voted down 3 times now in the legislature, is still an important action. I would say that that's not strategic to just this department, though, where I think this is to at least focus on our own game.
Okay.
Okay.
So not to
I read it
disagree,
differently.
not to disagree, but simply to focus. Again, we're zooming in sort of on what our department can do. We've got the chip. We have other things that are in the larger context than this department's focus. This is a piece.
So then page 5 is the one that says they're going to mail 1,000 postcards for...
Healthy start.
Yeah, so, I mean, have we used that tactic before? What's supposed to, that seems to me like
Yeah.
easy to measure that you mailed them.
So there's 4 types of, I guess, indicators, and that is simply a process indicator. That's not an outcome indicator. And that's, I believe, why you find it deeper into the plan is a process, not an outcome indicator. However, we could speak to that. We do have Shannon here, if you want to.
I think that one's actually mine.
Yeah, it's actually,
Oh, I'm sorry.
I
I thought it was
We mail
the...
postcards too sometimes.
Yeah.
Hi, my name's Cindy Farr, I'm the director of the Health Promotion Division. So this was, the way that we set up the strategic plan is that these actions are just supposed to further the objective. And what we're trying to do is to get more families enrolled in home visiting services, not just here at the health department, but actually in any home visiting services that are in the community. That's part of what Healthy Start's goals are. And so that would be a new thing that we have not, we've kind of piloted it, and it helped to increase enrollment in the different home visiting programs, but we haven't actually fully launched it. So that's why that was one of the actions.
okay. And then the next one with the Invest Health, develop a script and interview questions. I just couldn't understand, I didn't know what we wanted to know. I do not know what we want to know yet either.
You're just furthering the neighborhood walk-around program, is that right?
Well, they are doing another one. This time we're working with the university and also the larger new Invest Health Steering Committee. So the Public Health School at the university and their master's students and the new Invest Health Steering Committee have given input, and then they've reviewed, and they already actually have the survey questions So it's another check-in on Invest Health.
I just find the goal pretty vague. I mean, it's to say to engage community residents, so I guess it's part of it is, we're just
Yeah.
looking at these and we're
Yeah.
missing the whole
Yeah.
back.
And you have to take responsibility for some of that, because I don't, I wasn't here, and I know that you had a very wonderful discussion about if the goals themselves should be measurable or the objectives. And having come from a history of our goals used to just be directions from the board, like, start looking into obesity and get back to us. So in my mind, goals are much more, let's reach for something, and if it's a new area, which Invest Health is, and we actually almost took Invest Health out of the plan, or didn't put it in, because we had trouble coming up with the goal. And I decided I'd rather have a vague goal and have some focus on that spark, that new spark, than to take it out because I didn't have a perfect way of making it more specific and measurable. And that's just the judgment that I made. It was to keep the focus there. We don't know what the steering committee will lead us to. We've even discussed at the last steering committee meeting that we should have a planning session that is bigger than a strategic planning session to determine how we're really going to bring about change in this type of work. So that's really what it came down to for me, is take Invest Health out because we just couldn't come up with specifics yet, or put it in and endure that little bit of embarrassment and awkwardness that we don't exactly know what they're going to do yet.
Yeah, just a little question for the department, if we're not in control of it, that.
But we're leading, the department is really
Okay.
leading and co-leading. We're trying to move it to a steering committee, but it's not as simple as a small advisory committee or a grant community committee where you already know what all your goals are, what your work plan is, and they guide you. This is a new way of operating, and we're trying to find ways to keep it going beyond the Robert Wood Johnson grant. So that's why I put it in. It's kind of in a measurable spark right now.
So it was in more than one community, and you're only focusing on the west side this year in this plan?
We're starting with one of the neighborhoods and then attempting to see, it's kind of like we're piloting how to engage those residents. And so we're piloting it with one of the 3 neighborhoods, and if it goes well, then we would expand it to the other 2. If it doesn't go well, then we would have to reassess how we're engaging with them before we move on to the other neighborhoods.
I mean, I think one way of maybe framing this that I think, at least for me, would address some of the concerns is, why are we doing this? We're doing this because health disparities exist in these neighborhoods.
Correct.
That's a big, thorny, difficult problem. We don't know exactly how to fix those health disparities and whether there are even solutions that are within the public health realm to fix them. But we know that the health disparities exist, and we could quantify those in a goal. We could say that we want to, develop projects and programming that are going to address neighborhoods where these quantifiable health disparities exist. And then at least somebody looking in from the outside, it may not seem quite so vague.
Right.
I mean,
Yeah.
we know that there are higher smoking rates, higher obesity rates, food insecurity, go down the list, whatever you want to name that exists in these neighborhoods at higher rates. And we're trying to put some strategic effort there.
I think that's really helpful, and I think you took us a step further. We had a whole meeting just on this, put it in, put it out.
And we did actually look at that, but the problem that we're having is when we're able to drill down to those neighborhoods, the most recent data that we can look at to determine the health disparities is from 2010. And so being able to then come up with measurable data that shows 3 years from now that we've made any kind of impact is really not gonna, the data's not gonna be available.
Yeah, that's
So
right. That's
that
why I
was
don't
why,
like.
that's because we did look
And
at doing that.
You may not
so-
even be able to put
A number of
a number on it, but I think, or even if there's old data, just labeling this activity that
As a
That's
health-
the public health target we're shooting at with this
Exactly.
book.
I think you really hit the most salient point, is it is designed to address health disparities. That's really what it's
And
all about.
We may be
And-
piloting it in one
And in a neighborhood format.
and, you know,
Right.
trying to come at the elephant
Would
from
you
different
put that in the
ways,
goal?
but.
I know, but then we couldn't figure out how to make that measurable. So that's what
Well, so-
happened. We got in this on
Oh,
again,
yeah,
off
we
again.
spent 2 hours working,
So what is-
trying to figure out how to make that
So
work.
what are the interviews designed to determine?
So the interviews, from my understanding, are designed to determine what the barriers are to health in those neighborhoods. So looking and saying, you know, do they not have access to places to recreate? Do they not have access to fresh fruits and vegetables? You know, like, that's kind of what the interviews are trying to look at.
They ask them to, whether or
And-
not there's sidewalks, if they
Yeah.
walk anywhere, what their anxiety level is, what their income level
Right.
is, whether or not they have a car. There's
Right.
a lot of other questions too.
So this is to baseline.
Correct.
Right, we're still
Okay.
getting
So I think
baselines.
that's, so maybe the measurement is just the baseline, but I still think that if in the goal you put to inform health department programs and invest health in ways to address health disparities.
Yeah, just
Oh,
add
yeah,
that
we can
phrase
add
in.
that.
Absolutely, we can do that.
Yeah.
Then at least, because that's what I was like, what do you want to know?
Yeah,
Thanks for adding that, Doctor.
sorry to get so hung up on it, but
And I
we
guess
got really hung
objective
up
one,
on.
if it said conduct 60 West Side neighborhood to establish baseline data.
That's,
You know,
yes, exactly,
just
flesh
to
it out a
give
little
us-
bit more to.
Yeah,
Yeah, we can do that.
so we will get
Doing a youth
addressing,
assessment, You're doing a community survey.
Right.
yeah, we'll get the address health disparities back into the goal
Can you say a
statement.
minimum of 60 instead of just 60? Because if there is an ability, you know, you go
Yeah,
out
I
the
think,
door.
yeah, we could just add at
Because
least or
hopefully
minimum
you get more
of-
than that.
Mhm. Yeah,
Make it
correct.
statistically significant, I
Right.
would hope, but.
And so in the kind of the storytelling realm, I love the idea, you know, if there were some families that were agreeable and they realized people move and things change and
Right.
that kind of stuff, but if there's certain families that you can follow through, if you move out to neighborhoods, but at least are always checking with them, so in 10 years
See
we
if
have
there
their
was
story,
outcome from them.
you know, I think that would be really interesting.
Oh, yeah.
And try not to filter for like, looks like these people are gonna make it, you know, let's follow them. I mean, just see how it happens organically, but those are neat to be able to track people.
Yeah, I will
through.
definitely make that suggestion.
So on the page 7, the one that talks about educating elected officials on lethal means, so in action number 1, I'm not sure if the commission has.
Where, I'm sorry.
Page 6.
Page 7, oh,
That's
mine
for
says
suicide
7.
prevention.
Suicide prevention. I don't know. It's objective 1 under strategic priority on suicide prevention. I mean, objective 3.
Mhm.
So I'm not sure if the commissioners have that authority, that's the only thing I asked. I don't know what means restricted legislation.
That's what that
So
action.
it's just a presentation.
It's just to educate elected officials on what that means.
Okay. And then the one that I always, I mean, I think the work that we do in training people is good, but I just printed this off today, this zero suicide stuff, just because I think what you're doing is really good, but if we don't start connecting people and identifying people and getting, I mean, we can train ourselves so that maybe we recognize, but if we can't get them into something, we're losing them. So is there something else that we can add to talk more about coordinating? And maybe you're already doing, maybe that's what you're doing through Project Tomorrow that I
Yeah,
just.
that's, yeah.
And then I wasn't sure whether 3 op-eds was going to, I guess it's just a continual
Yeah.
education. The next one on environmental health, the air quality, the stuff that we've done is amazing, but I wonder if we should add another, more of a community education for folks, what can you do at your own house? And I know that Sarah's done that through some of her stuff, but I think it's good to put it down. Like this year, I bought myself, my daughter-in-law, a filter to put in our house for the main space, so just adding I think it's great for us to focus on the schools and public spaces, but a goal on,
So maybe instead of number 2 under objective where it says look for other opportunities, maybe you create some demonstrations with other partners.
So objective 2, right? We're on objective
Yeah.
2, under
Page two.
goal 1, under environmental, okay.
I think it's kind of just inform the public what they do themselves.
We are informing the public, and if you want to capture that as an activity number 3, we are doing that.
Yeah.
And we will continue to do that, so that could be added as a,
But I can see
Number
where you do a
3.
demonstration too, like the guys who build the little sheds over in Bonner, maybe you get them to bring one into the mall, and then you show people, this is how you would seal your windows, or this is how you would seal this room, or this is how you would use an air filter, or something like that, just so it's an active demonstration.
Or even the,
Or this is
Or
room
use-
that's
or
properly
use
sealed, this is
MCAP.
room that's not, you know, kind of a thing.
okay.
and then I worry about the one with Sealy and their air and the wood stove.
Yeah, we do too.
I mean, somehow it needs to be their idea. How do we get there?
Mhm.
Now you're talking philosophy.
No, I'm talking that you're going into a community that can get wood in the woods and burn.
Right.
And if we need to get to pellets, it's gonna be a big transition and it's expensive. So I'm just leery
Yeah,
about how we approach it is all.
We are too. I think in here, especially, you can see how short the activities are. They're very almost terse. And the first one is to discuss potential ideas with the community, so I
That's
hope
kind of where we're at.
hope that captures it.
Yeah,
We're not
that's what I would say it was.
under any obligation as a department to draft rules by June 30th of 19, are we?
No. I mean, well, we're under an obligation to do more because we are violating up there.
I just
But-
think it's an ambitious 6-month goal, 3-month goal.
Yeah.
Is there any chance of getting somebody to donate pellets or donate compressed logs up there to let people try them?
We did a pilot.
We did
a pilot.
We did have them try
3
them.
people.
We have data on that.
Yeah, we did that last
Oh,
year.
right, that was more widespread than just 3, I mean.
It's just that they aren't made locally and it's expensive.
Right.
So one of the things that we're looking at is actually, there's some wood stoves that could actually use wood, that are low emission stoves, they're pretty expensive, but
Yeah.
it's really focused on new. And so what we thought, since this is a 3-year plan, what we thought we would do for the first year is look at how we can keep it from getting worse, how we can keep it from having more wood smoke in the environment, as opposed, so it would be new stoves, it wouldn't be anything about replacing the old ones, or, but just if you're gonna build a new place in Sealy and you wanna heat with wood, which makes sense up there, then what would the regulations be? So that it kind of protects the people who are there already too, right? Because if it just keeps getting worse and worse, it could end up with no wood could be burned at all, and that would be difficult. So we don't know what the answer is, but I did want you to know that one of the options is actually a wood stove that burns wood, and you don't have to have pellets, so.
And then I have a word that got I'm also going between the two, and actually we were going between the two. So I was working on this one, and Julie was working on this one, and then we would say, well, this doesn't match, and then sometimes we would understand who was supposed to make it match, and sometimes we would each take the other's words out and make it on match. So this is an example of one of those communications. When you get to the very last section and the very broad and new and yes, underdeveloped goal in the work plan, which is supposed to match the goal in the 3-year plan, the word implementation got left out of the branding and marketing plan. So, section 4, page 17, goal 1, it's design and implement. It's not just design. And the 3-year plan does have the word implement in it. We did have a lot of other formatting and other issues we think we've addressed, but we realize there may still be some, especially when 2 different formats, 2 different workers. So we're still open to finding those errors and fixing them. We are a third of the year into the first year. And we do have to have this plan ready to file for accreditation, which is why we are pushing it for October. We are going to file our application in December.
On the branding piece,
Mhm.
you know, this talks about, so maybe there is no spend in this fiscal year. We didn't budget for it, right?
Well, I usually by this time have brought you, we didn't budget for it. We do have cash. I usually by this time have brought you for action the cash budget. I did bring it to you for your information back in June. I did expect I would have your action on it in September or October. Unfortunately, we are working with the county CFO right now to reconcile the tax levy amount it seems to be wrong. So I don't want to bring you that until that can get all figured out.
Okay, that makes sense.
And that would be where you would act on that.
One word I'd recommend that we change on page 11, it's probably an acronym that you guys use, FBI, but it's in the foodborne illness section, but I think that we should probably take FBI.
Okay.
It does too.
Yeah, FBI complaints. When the FBI comes and says we have bad food in this
But
restaurant.
if it's on the list, then we're okay.
Jean, if
It
you
is on the list.
if you look in objective 2, action 1, it is defined in action 1.
It's still just a normal.
It just,
And then the acronym only is used in action 4.
it
Keeps people on their toes.
What's the FBI? It is still alarming when you read it.
And then the last one that I have something on is the, in mine it's on page 15 anyway. I was talking about the maternal health and I don't see any reference anywhere to the KELP program that we're starting to work on, which I was working with the foster kids. I mean, I don't see them as being part of the.
Oh, you know, I know a place we can put that, Jean, because I had that same thing with the, let's see if I can find it, with the CI program, Collective Impact Program. We're staying at that table. Let me see if I can find it. Where is it?
This one, of course, is in relation to well-being maybe. It seems like we need to better coordinate all, I mean, we do a lot of
Yeah,
things
no,
in
no,
the
no.
community, and the
We-
community does a few that we just need to coordinate with.
I agree. We have to stay at a lot of tables, but Sarah and I talked about highlighting a couple of them, and one was Collective Impact, but now I can't find it.
I don't know, I saw it.
Stay at the table, grant writing. Oh, that's because I'm in the finance part, and I'm looking at MCH finances. Hang on. If we go earlier in the plan on MCH. All right. So on page 2 of the first year plan, strategic priority 1, maternal child health outreach and marketing, goal 2, activity 3. I would propose that that's where we add KELP, and we will write it out, because we are staying at that table and will be at the strategic planning for that in November.
And so
Thank
then
you.
we should probably add that to our acronyms.
It's not seaweed.
Oh.
One of the difficulties with any strategic plan, especially when you've got this whole, you know, you've also got the community health improvement plan, the different grant plans, and then your mandates, is deciding when you put the filter on for a strategic plan, what ought to show. which piece of it, and it is difficult, and getting your view on that. Are we showing too small of a piece, too broad of a piece, the wrong piece? I think is really helpful, because it used to be you just wrote the strategic plan and decided what, what seems strategic, but we really do have to connect it to all these other things, and it makes focusing on it very tricky, I think.
And then even though I won't be on this board, when we probably get to the point of the branding stuff, I still I'd be interested in being involved as a community member.
Come help us. Seeing as you know about branding irons and whatnot.
I do. I have branding irons. So as we adopt, we've already put forward some corrections, but when we adopt, we find words that are spelled wrong in the wrong place, right?
Yeah, I think how we have it on the agenda, and I know we've jumped to the year one plan. How we have it on the agenda is to approve the 3-year plan, which I don't think you made, or that we need to make more changes on unless we find errors. And then we would ask you to adopt the 2019-20.
The plan is what we've got numerous changes to make on.
The one-year work plan too, but not.
Yeah, that's right. We made them on and we have to carry these over to the ones that aren't objectives and actions, but are goal-related. We will carry over.
The whys.
Right.
Okay.
So the motion would be to adopt first the 3-year work plan.
No, adopt the strategic plan. We approve
This
the
one.
work plan.
It's on the agenda in the right order.
Oh, week's been this way. How about you make the motion?
The motion is to adopt the fiscal year 2019-2021 strategic plan with any changes carried over that need to be brought forward from the changes for the 1-year work plan.
I would make that motion.
Or you could say goals,
You got
goal
that, Julie?
changes.
You got that written down?
Or you could say goal amendments as discussed. And then we
Yes.
have the record of all the goal amendments in here.
Okay, I would move that we adopt the strategic plan with the goal amendments that we discussed.
Any other board or staff comments? Any public comments on the motion?
I just have maybe one brief one, sorry. I'm trying not to talk too much, but I really appreciate work. I know that this represents a tremendous amount of work on the part of leadership and staff, and I appreciate the responsiveness to trying to make, goals more time-bound, measurable, objective. I think as we're continuing to implement and work, I still would like to see us be a little bit more data-driven in how we're strategically applying the resources of the health department. And I think that sometimes that's difficult because, some of the community needs are to not have water be contaminated or to not have, foodborne illness outbreak. And it's hard to, measure the absence of something, but I think there are still some areas where, as we're applying limited resources, we want to make sure we're applying them to the greatest areas of need within a given area. And in our portfolio of maternal and child health, for example, what are the greatest areas of need in our community? And I think we could still continue to work to say we are an outlier on maternal and child substance abuse. We are focusing our, our eggs in that basket or whatever it is, just to make sure that we're, both doing things that feel like valuable work, but things where we have the biggest gaps to close and the biggest differences to make in our community.
I really appreciate that, and I think, again, well, this whole strategic, without revisiting it, we've done 20 years of strategic plans and even changed them with accreditation and really never had this much difficulty that doesn't need to be revisited. But anyhow, we've come through with, I think, improvements and good goal areas. One of the things that I think would be helpful to understand, and it does not take away from your comment at all, is we have in the past few years developed the performance indicators, and so many of all those performance indicators are completely data driven, and you won't see them here. Now, I think we can learn from how we did those to how we can make these even more data-driven, but we've had some internal struggles with what belongs in the performance indicator, and if it's one we're flunking, does it belong here, and what belongs as a strategic plan, and so that is part of the adjustment that we're struggling with, but we continue to try to reach.
And I think there are lots of areas where we're doing this.
Yeah, there's lots of ways we could do it.
Criticism, but I think
yeah,
continue
no.
good work. Let's continue to move in that direction.
I understand. I will
as much
say
as we can, so we're addressing all of the sort of flashing red warning lights.
I agree.
As best as we can.
I liked when it used to all live in the strategic plan, but yeah, we'll continue to work on that.
That's a good comment, and maybe what this board could use is just a sort of a memo from each major department about what those biggest gaps are, so that we would know, where to focus.
Right, we can look at other mechanisms to do that as well, that go to that point. Well, even in the plan, I mean, we used to use the indicators. Do you remember when we had the indicators on the plan? This is where we were with certain maternal child health measures. Well, then the indicators never change because some of these problems it's going to take 10 or 20 years to change them.
Right.
And then it was like, well, the indicators never change. So, we're continuing to develop how to do it so the strategic plan is useful. And who is the audience for the strategic plan? Well, it could be anyone in the public, but it also has to be it has to be the staff who are actually often in the activity level. So I'm taking your comments, I'm just trying to continuing to find a way to make them fit this new arrangement that we have.
Because I think one of the things that we did in the strategic planning, and you weren't able to take part, was adding the what's fading, standard, trending, and radical. And I think the fading, that's where, because of the Affordable Care Act and because of a lot of other things, we are not the primary place for kids to get their vaccines anymore. So we need to, those are the kinds of things I think it would be helpful for departments to say, we're probably going to have a certain percent of people that come for that, but can we take that energy we used to put there and put it in the...
Although our vaccination rates still stink.
Part of it is because we have no registry.
Not that there's no more work to do, the work may be different, but...
Well, if you were to call the state health department or us right now and say, what exactly is the vaccination rate in Missoula County for such and such, if you were a reporter, you could not be able to just get that answer. I mean, right there is a problem.
Yeah, that's the problem.
One of the things I would just add to reflect on this, and that's all it is a reflection, but as a site visitor for, nationally, looking at strategic plans, and so I see strategic plans of departments that never did them at all. Then I see strategic plans, and I know you've seen this too, from departments that did them like we used to, and then we got to do it differently, and kind of, so everybody struggles with that. But I recall seeing the first strategic plan that was completely internal, completely. We're going to work on this on quality, this on workforce development, this on community, it had external aspects, but it was all that type of how do we operate. And when I first saw it, I was like, I mean, it met most of the measures, but it was like, what's this? It's not connected to public health. But now I'm starting to, even though I think they erred too far, now I'm starting to understand why they did that, because they have their outcome goals, either in their performance measures or in their community health improvement plan, and they said, okay, this is how we're going to operate as a good organization to meet those. And I think I'm trying to live in both of those worlds with this, and I'm not sure where I should land on it. But this conversation really helps.
It's all good. Any other board comments? Any public comments on the motion? All those in favor signal with aye.
Aye.
Thank you.
Opposed?
Thank you for all your time and thought and review.
Well, we're not done.
Yeah.
Next up,
Work plan.
1-year work plan.
With amendments as discussed.
I would move that we approve year 1 work plan as amended.
Okay, any board questions or comments on this one?
I'm assuming we're gonna see the amended work plan again.
Yeah. We'll send it out.
There was just one, I don't know where it is now. It was under the Goal 3 Strategic Priorities for Health Services Program Participation on page 3. Objectives, number 1, with the action required. Could the materials be clarified a little bit? Develop materials with assistance from gatekeepers. I'm very unclear about what materials those are that will be developed.
Okay.
So we can add that to the list.
I can, I am assuming, and that would ask you to assume, and you can't do that.
Yeah, and I know what it's asking. I mean, I know what it's asking, but it just
You
isn't
can almost
clear to
see it.
anybody else who might not have the
WIC,
background.
WIC referral and program materials, would
Yeah,
that help?
That would help.
Yeah, I can even see the brochures in my mind, but it doesn't
Yeah,
say that.
No, I know exactly.
WIC
what it-
referral and program
Yeah,
materials.
I know exactly what it was, but.
Okay.
Anything else? Any public comments? All those in favor of the motion signal with aye.
Aye.
Opposed? Motion carries. And you're up again, director's report.
I don't think I have one.
We can see what you've been working on, so.
Okay, that works.
Thank you. If I miss something, I'll send you an email.
Any public comments on items not on the agenda? No? Any other board or staff comments on items not on the agenda?
I have one. So, the first one is that I had a public citizen again complain, and it might be a city council thing and it might be a health department, I don't know. But the Iron Horse, ever since we passed that thing saying that you could say you can't smoke on my sidewalk or my patio, they have decided to put 2 tables out there that you can sit out there and smoke, and so the waitresses are coming there. So I just don't think it, but apparently there's some sidewalk rule that the city has.
It is Sidewalk Cafe already allowed them to make that choice. I think what we did maybe brought it to the fore, to their attention.
So they can have smoking outside?
That under the city
Discretion.
council
Yeah,
Sidewalk
As long as it's
Cafe.
25 feet away from the front door.
But
So
it's
they
still
can
on the
move.
people on the sidewalk can't avoid it.
But it's a
Yeah.
private sidewalk. Their sidewalk is technically their own porch, kind of out front. Yeah, I mean, they're.
You're not talking about the Higgins sidewalk, are you?
Yeah.
You are the Higgins. Yeah, I saw that in front of another bar I won't name.
You're not talking about directly in front of the Iron Horse?
No.
Adjacent to the
Not
parking lot?
They put the smoking area over on the Higgins side.
Yeah, I hadn't seen that, but I did see that exact
Well,
thing.
it's kind of in the bushes,
Yeah.
but.
They can't do that.
Yeah. However, it is a Sidewalk Cafe that allows them to make that choice, and that's been in
You
the
still have to
ordinance
walk
for a while.
past the cigarettes,
I-
so I don't like it.
I think it depends on the width of the sidewalk, though.
Yeah.
I don't know if that sidewalk's wide enough for them to do that there.
Go ahead, Shannon.
It actually, the ordinance does not restrict people from smoking on a sidewalk. It just allows businesses to say you can't smoke within 25 feet of my business.
Yeah.
And so, and then
Or front door, yeah.
yeah, or any window. So, I mean, it doesn't even restrict them from 25 feet.
Mm-mm.
It just says they can.
Enforce it.
Yeah, and then.
So they turned it around, because this popped up right after that.
It did, but it was always allowed.
It was always allowed, this brought attention to it, I believe.
Yeah, so it was always allowed that you could smoke on a sidewalk. In fact, it was not clear that a private business owner could restrict somebody from smoking on a public sidewalk. And so that's what it did, is it allowed them to restrict it. They could always restrict it within their sidewalk cafe, because that was also an option. But again, they don't have to. So any of those sidewalk cafes, any of them could allow smoking.
Yeah, they could have.
And they could even allow smoking if the smoking drifts inside, because that is not part of the Montana Clean Indoor Air Act.
So people
Right.
just need to let the Iron Horse themselves know, we don't really like
They
that
don't like it.
past
Right.
stinky area.
Yeah.
Right.
Yeah, the only public area, Shannon, right, was parks and things. That was the only public outdoor area that
Yeah,
the
they were
new ordinance,
restricted.
the new ordinance
Right,
applied to.
there were very specific parks, yeah, and then other outdoor spaces
Where there
could
could
be
be
restricted
children
by,
and
if
then
the
other-
person wanted to.
Yeah.
Mhm, they can be.
Yeah,
Outdoor public spaces and gatherings.
yeah,
Yeah.
yeah.
So then the other thing that I just wanted to bring up is we've talked about holding tanks before, and this is just stuff from Lake County, just so you know. So I'd really, I've visited with Nick Chicada lately, and I know that he's visited with staff too, and he says staff has been good to work with, but to me, there are times when it makes sense, more sense so we're talking about an amphitheater, and the fact we gave him a variance for 2 years, but he needs to submit some plans to get them approved by DEQ. If you go to the page that's marked page 25, they have, in Lake County, they allow holding tanks for certain things. Then I found that they had adopted these standard variants for holding tanks, so to me, it's just an idea that I would like the board to consider asking staff to do a little research on. Protecting public health, of course, is our goal. If you look at page 29 in their stuff too, they also talk about, still protecting the river, protecting all the things. Their stuff here is really similar to what our regulations say, I'm sure. But, so he does not have a lease on enough property, as Shannon and Gina know, to have a drain field. His project out there is totally limited by season. So his preference, and so I just want us to consider whether it makes sense to add certain criteria to say that there could be times when a holding tank or a facility that's seasonally limited, has 20 events a year, he's gonna overload a septic system anyway, so just for the bathrooms that he has 2 bathrooms, 2 showers inside for performers, and when he had a couple systems back there, must have been big groups back to back, he pumped his septic tank anyway, because that is already served on a septic tank. So it just seems to me like there could be times when it makes more sense to not encumber, especially, it's taken 30 years to get a sewer in Seeley Lake, and it's gonna take time to get a system in Bonner, and it makes sense, but in some ways, a holding tank may make more sense than even a holding tank that meters out to a septic tank, a drain field, just because of the amount of land it takes. And there are safeguards. So anyway, I just wanted to bring this up for the board to think about whether we'd like staff to think about it and bring us back some thoughts.
So what
And
you're
this
asking
is
for
a-
is research for perhaps.
Seasonal is what I was looking at. It would be things that were seasonal, not, not to allow the whole mill site out there to end up being tanks. We don't want that. But there could be some instances where this makes more sense than encumbering a huge amount. Because, when you have 4,000 people come for something, even if he had a big old drain field, he's going to have trouble. He'd have to have a huge tank anyway.
It's redundancy system.
And so, but research that could move to a rule change from Regulation 1.
A rule change or some addition to our variance. Lake County allows, with these two resolutions they passed, they created some points where the staff could, they could decide to bring it to the board, but they could make the decisions administratively based on all these other things being met.
So like section 4.3H, and it says if you meet sections, A, B, and C, D, DEQ, then you can have a holding tank for, these reasons. So that's
Right.
the addition, adding like that section H for rules.
And you'd still have to meet the variance.
So, I don't have any experience with holding tank issue right here for a moment with standard variances.
Yeah, this is new, I'd never seen it.
Standard variance?
Perhaps it's one that's just more rote.
We have standard variance?
We do. We have standard variances in the food regulations, and that's because the temporary food requirements for how you built a booth was like way overboard. They had to only have a window that you could put food out of, and it had to have 4 sides, and so that didn't quite meet our 3-hour, out to lunch. So there are some kind of standing variances in that section.
Shannon, does that term essentially mean you don't need to bring it to the health board, but staff can approve the variance?
Yeah, but it's also different because it's based on it's based on a different law, and so I don't know. We'd have to look at it for the wastewater regulations, because the wastewater regulations also give people the ability to, when denied, to
Go to DEQ.
Go to DEQ, and so it's just something we'd have to talk to you about. I've seen it before. I know that Lake's not the only county that has this kind of standard variance, but some people do things that we've adopted in our rules. For instance, we say for replacement systems, we're going to do the best we can for a replacement septic system, and it might be too close to a well, or it might be too close to surface water on these old lots. Some counties have looked at it like you have to have a variance for each one of those things, which, believe me, would totally overwhelm this board if we had to do that. And so I think Lake or another county has done standing variances for that, for replacement systems, but we've got that as part of our rule. And so DEQ frankly lets people to have holding tanks under some situations, so it really is our rule, and so it really would be under what circumstances would the board want those to be approved, knowing we're not for it at all, but and then what the process would be. Is the process a variance, or is the process an approval under certain circumstances? And then if they don't meet those certain circumstances, you can apply for a variance. So.
And it still has things in here like if you don't follow what we've said, then you still are held accountable. So I just think it's worth looking at, because so in that case, again, he's going to have permission from an adjacent landowner or past his lease, so he's leasing, for additional land. Would a holding tank really protect the water quality in the area better? I don't know, we're right by a river. I just like staff to kind of work through and see if we could, and again, I don't want this to become that everybody can do it, but there, to me, are certain cases that it might make more sense.
And right now, he could come and apply for a variance, because we have approved holding tanks on this board before. For MBT,
We only do it for government though.
Well, you've done it under a variance for the fire department and under a variance for MDT, but it's not limited to, you're not limited
Not
to who
limited,
it's
it's
done
a-
for. It was,
I think
both
it's
of
a
those were
government.
by variance,
Okay,
yeah,
yes, I think.
so you can do it.
I
yeah,
think you can do it.
yeah.
I just think it's worth looking at to establish, again, how are we gonna protect water quality? Doesn't have to be a priority, I don't know if the rest of the board thinks it's worth looking at, or I just thought I'd bring it forward.
I don't know if we're looking, are we looking at anything in the rules right now? In terms of.
We
in terms of
always,
opening?
we're always looking
We're
at.
always looking for
we're
things,
always
but
looking
in
at
terms of
rules.
actually opening the
Yeah,
rules.
no, we're not. And
I
I'll
didn't
tell you,
think so,
I
but-
just have to tell you that we do not have enough capacity in our land staff right now. We absolutely are, I mean, a lot of people are saying, where's my whatever? And until we can get that fifth person hired and trained, we really can't look at taking on that project. We're really,
But what I'm hearing is that Nick
Of the rules
could come,
change.
bring a variance application that included a holding tank under the current rules without
Yeah.
any change or any standard variance language such as what Lake County has.
He'll just have to appear here.
Right, it's the
Which is a different
standardization
way.
part that
Because
Right.
he's
I.
working, he's trying to meet his, he was supposed to by October 1st, so he has his consultants working on stuff. So it sounds like he could then just have him put that forward. I mean, he has a variance for a whole nother year that we gave him. for his own
Right,
work
we
bodies.
strongly encourage that he go for 2 years instead of one,
We do.
because he does put himself under some very tight,
but he
Deadlines.
The first time he did.
that's the
Second
first time, but the second time,
The second time we did do 2 years.
yeah.
Okay.
The second time, we said, please go for 2.
They did it.
He did.
Okay,
Yeah.
yeah, okay.
Just because of timelines, we knew it was gonna be tough.
He felt it was
He
maybe
wanted
just
to go for
keep it
one.
on the radar.
Okay.
And so we do have a whole list of things that we are keeping on the radar for rule changes, and we could easily add that to that
And it
list.
also sounds like you have your existing variance criteria that could be addressed in any variance application that included a holding tank.
Yes, yep.
Anything else? So with that, we'll adjourn and reconvene as the Water Quality District Board. We do not have minutes for water quality, so we will get the Water Quality Advisory Council update.
You know, these big sites that often, we're always like, okay, what stage are we at? Are we done with the human health risk assessment? Or if there's more data, will that go into that and then that'll be reflected in the feasibility study? Or are we still in remediation investigation stage? And so I'd say we plowed some ground again with EPA, but it was mainly just kind of, it was good to get them in a room and just ask some questions that we had. One of the challenges for us, I think, as council members too with this site is when we're asked to comment, it's like we've got to go back. It's been months since we've read, the hundreds of pages of documents, and we almost have to go back and reread and, remember like, oh wait, they already addressed that, wait, so what are our questions still? So it's just good to rehash things with EPA and DEQ. So that's kind of what the meeting was. EPA did collect some more data in 2018, and that should be ready early next year, early 2019, some more soil and water samples. But a lot of the concerns we had related to, are we ever going to see one document that just has all the contaminated groundwater samples on it with a map and all the soil boring samples? And because there's been, if you've been following along, there's, I think we're on addendum 9 now of the remedial investigation, and each one of those is a data set, and of course we've completed the human health risk assessment, and so we just are kind of curious how this all fits in. And so the answer to that question was the remedial investigation document actually is not complete yet, and that will be the one document that has all the information in it. The reason that's not complete yet is because actually the human health risk assessment is not complete. So they're still gathering data that they say they will feed back into that document. So it's supposed to go human health risk assessment, remediation investigation. Sometimes those two have, arrows that circle through them, but then the feasibility study. And the feasibility study is when they basically are going to start saying, here are ways we can clean up this site.
And if you thought that at that stage they'd be done, it's not true, because if the PRPs, the potentially responsible parties at that point say, well, if you're gonna clean up this landfill, landfill's 40 acres in size, and we've only taken 2 samples, so can we take more samples to find out where it's really contaminated? So there could still be more sampling and data at that stage. So that was, I think our concern as the council we've had for a long time is, on one hand, if you've taken 1 sample in 10 acres and it's contaminated, well, now the whole thing's contaminated, and so potentially you have to remove the whole thing. But conversely, if you take 1 sample in 10 acres and it's not contaminated, now they're saying the whole 10 acres is clean. And that's where we're, of course, uncomfortable. Just, quick review, yeah, they've found, dioxins and some heavy metals, arsenic and manganese in the groundwater out there. And so we reminded the EPA and DEQ we'd like to see some kind of groundwater model, because there can be fissures and preferential flow patterns underground, so that even if you punch wells and you get some contamination, you might not be seeing everything underground. So we talked about that a little bit. There's really high manganese out there. It's like really screaming hot. So if you had around 50 micrograms per liter of manganese in your drinking water in your home, you'd see like black staining in your sink and stuff like that. And that's considered a secondary drinking water standard, so not a health risk, but like more of a aesthetic standard. So 50. Out in Smurfit in one well, it was measured at 50,000.
Wow.
So, and everyone's kind of stumped. They don't really know what's causing it. So it's kind of an interesting question. There's some ideas posed at that meeting. So overall, it's a good meeting. Sarah Sparks is going to be retiring as the Region 8 overseer of this project, I think in December, and so her replacement, Allie Archer, was there. So, so there's some good transitioning there. And so that was the gist of that meeting.
Did they have any indication of timeframes for the human health assessment?
They're waiting. No, they're waiting on that next round of data, and I think they're still waiting on fish tissue data to come back to influence the BERA, the baseline ecological risk assessment. So it's still a long ways away to finish this up. The other main thing we talked about at that meeting was watershed restoration plan, WRP, for the Middle Clark Fork River. Vicki Watson is an active member of our, well, not on our council, but basically from the community that brought this to the council. And what she was looking for were stakeholders to support this idea. And so a watershed restoration plan is something that it's a plan to fix, an impaired water body. And the Clark Fork has what they call total daily maximum loads, so these TMDLs, and they can be temperature or sediment or just things that make the water, not as productive as it could be for its intended use. It has that for the whole length of the Clark Fork, but only certain sections of the river have these WRPs. And why that's important is you need now a WRP before you apply for what's called 319 funding, or restoration funding for that water body. And so the TMDL document, I guess, is hundreds of pages long. So Vicki has some grad students boiling that down, and then the Water Quality Advisory Council and other groups are going to be presented with that info. And basically what Vicki is looking for is stakeholder interest so that she can write a WRP, watershed restoration plan, for that middle part of the Clark Fork. And so that area of the river is kind of like the area that goes right through Missoula, more or less. I don't remember the exact boundaries of it, but they call it the Central Clark Fork, and so we tend to think of the Central Clark Fork as being farther upstream, I guess, but it's kind of what we think of as the middle section of Clark Fork. But anyway, so that was an interesting talk. She gave a great presentation about some of the current impairments of the river and stuff like that. So. And then Katie Morris from DEQ did mention, when we were talking about some of the contaminants at Smurfit Stone, that they're going to be updating DEQ 7, the water quality standards at the state. And so we invited her to come back to the council and have that be a separate agenda item, is to talk about DEQ 7 some more. So.
Any public comments? Any other board and staff comments for water quality? With that, we will adjourn and reconvene as their pollution control board. We don't have minutes. And Sarah's not here, Kathy's getting here. I'll give a TPCC update, and this was actually, Jean was there, Sarah was there, I was there. It was a joint meeting of TTAC and TPCC. It was huge. And we were primarily there to review the strategic plan and document for Mountain Line. So a lot of good discussions about short-term and long-term potential for Mountain Line. I think, for the purpose of this board, I think Jean and Sarah hit a couple of points that were common about the fact that the bus doesn't serve this department and Partnership Health and the food bank, which are three places that people need to get to, and between the two as well. I think that they did listen in some future routes, and I can't remember if it was the long-term route. It does show bus movements on Wyoming Street. That sounds right to me, but I don't even think that, but not here.
It also certain events goes around the north side.
So did they tell you why? So I brought that up again with Corey. He's like, well, you have a brick street.
Yeah.
He said, we can't go down.
Which is baloney.
We can't go down a brick street. It's too much, it's too hard for the buses. And he said it's really the responsibility of the city, the county to build acceptable access from the existing bus stop to your.
He told us to move the facilities to where his bus routes are.
Yeah, that was one of the comments.
Buses in Europe all the
Really?
time, and they have tons of cobblestone streets.
No, it's just, I would say that he didn't listen, but I would say the board member did.
Yes. Yeah, agreed.
They can't go down a brick street, huh?
He didn't say that there.
Well, he said that.
I've heard
just
that,
told us to
though. I have
move.
heard
He said
that.
that at a neighborhood meeting.
Yeah, I have heard that, and I thought I was hearing that it was a rumor, but
Yeah, so those great big buses can't go down that, but we can. You go down streets that have bad problems.
Yeah.
We have to stay on them.
And that there wasn't turnaround capabilities for the bus and things like that. But I mean, it looked as though if they, they're on Russell,
They can come over
turn. But
here, they
I'm
can
probably
go
being
over
short-sighted.
there and they'd be right back to the street by St. Pat's. I mean, and it wouldn't have to be every route. I walked to work this morning, so I was paying attention to the routes. And I thought, sometimes that number 2 bus faces this way and sometimes it faces that way. So it could be once an hour or something.
Yeah.
But anyway, that was a little disappointing.
And Sarah's comment was about, there's a new public housing, development going in.
North side.
That's not.
So is there,
Serve it.
for this particular plan, is there still a comment period for PHC to try again? I know everyone's tried, and we keep trying, but is there still an opening for their current strategic plan to give it another?
I feel like there's not for this current plan as it sits. And this was really a study, actually.
The consultants did.
Yeah.
Oh.
Because it was the consultants coming to give us the report. Because at the Midtown Mojo, which is kind of a Midtown meeting the other day, COLA attends those, and the consultant that Midtown hired wants to take cars off of Brooks from South Avenue to Fairview. I don't see anything that I would ride my bike or walk to in that little stretch. Anyway, the vet is in there, you know what I mean? Cola, of course, told me they were a little on the crazy side, but.
And it was interesting because one of in the plan, the Mountain Line plan, it showed bus movements across there, and like one of the comments was, we spent 10 years unwinding Malfunction Junction,
And they show it.
It was 25.
They show it. Okay, I missed the first 15.
Yeah.
But,
You didn't miss much.
But, I mean, they showed it going across, and someone said, how's that working? Because it was just, just these kind of wild arrows, like, this is what we're gonna do without, I was sitting next to Ed Tape, so it was interesting.
Don't worry, there's no funds to do it, so.
Well, that was my question. How much does this cost? Because there's no money to.
$200 million to redo that whole corridor, it's not gonna happen anytime soon.
Well, not only that, but just to implement the short-term and the long-term. The short-term implementation, I think they said was $4.5 million, and the long-term was, and I put my notes, right where I was gonna bring them, but I haven't written down, but, a lot of money to implement, so.
Is Mountain Line a public entity?
Mostly federal funding.
Federal funding, but
It also gets local funding now.
Yeah.
I mean,
City,
I'm wondering,
county, businesses,
didn't, when we went fare-free, didn't the
Yes.
city
Yes.
and the
Yeah.
university
Yes.
and St.
Yeah.
Pat's and
And the
several
county.
other
They
big
were on the county.
employers
Seven partners,
Right.
yeah.
kick in
Right.
money?
Yes.
But that's for just the
Can
zero
those
fare,
partners
that's-
exert some pressure?
But that's what I was trying
Here's
to
those
do, but I was
partners.
told to move the facility. I told them this one had been here for 40 years, and that one just invested millions of dollars as did.
Yeah, so they have a mill, they have a county mill that supports, city.
No, it's a voted levy.
I thought they had a mill too.
It's,
So the
That's just for
number-
buses
And
that
I've heard-
exist, and then they have partners for the zero fare program.
Yeah.
and I've heard that they want to put another big.
Well, a voted levy, the dollar amount will not change, is that correct?
But there's people who live on Mullen Road that get no service that pay $200 and some
Yeah.
dollars a month.
Well,
Yeah.
Same thing in Miller Creek. And
Right.
then Vista, they get new service.
Yeah.
And some of the new studies actually show that it's more beneficial for them to have a route from Lolo than it is to increase routes in town.
Well, because people
And to the
can't live
airport.
here anymore.
They do have one.
It's to the airport now.
It goes to the airport. Probably not today.
Oh, God. Oh, you had to mention that.
It does, it used to
It's
go
not been a good
to
day.
Frenchtown to the mill too. And folks on Mullen Road used it a lot then, but they don't.
So it was a
This-
lively discussion, all 26 of us in the big circle.
I'll show you what it did.
But that was the meeting. So we did TPC. Do you have any other comments on TPCC?
No, I believe I wrote on my handout thing irony when they talk about how we need to undo the change to malfunction junction. Because, the idea is like buses are better for air quality, but they want to undo the changes we institute specifically for air quality at that intersection. No, I felt that the group was well contained, like nobody was like, came out and said to their face, this is never going to happen because we put so much work into making this configuration what it is.
Yes.
We just kind of let it go.
Yeah.
Which I felt was very grown up of everybody.
We did do well.
So
Tell us
reversing.
how you really feel.
We are still sort of on camera.
We're grown-ups, did you hear? Going back to agenda item 2, Air Quality Advisory Council update.
All right, so this was not a terribly packed meeting for things to talk about. The journal article was a piece about how many chemicals people are using in their homes and how indoor air quality is kind of steadily becoming more of a health concern. If you think about the amount of people are exposed to, then say what we are getting out of cars and vehicles. The VOCs that we just put into our own air at home is surpassing what we see as VOCs coming out of vehicles these days.
Wow.
So that was interesting. And then we had a nice lively discussion about VOCs. James Stevens was there, so we got to have him there for the first time. And he shared many things about VOCs, so that was great to have his knowledge there.
So are there numbers on things like
That was lively.
pine sol and stuff like that?
I don't know. Pine sol.
I hate pine sol.
I knew that, or you wouldn't have said pine sol. And I don't have the article in front of me, so I can't. I also didn't grab my minutes notebook, I grabbed my other notebook, so we're even more out of luck for that.
Well, I'm glad people are having this thing.
We are looking at the advisory council charge, because I know this body is looking to evaluate and affirm or change charges as part of our accreditation. They have some super minor tweaks that they're interested in, but they didn't vote on anything at the last meeting because they're looking at the wording. There's a phrase in there that is lifted directly from our rules, but it's in rule-ese and not English. And so it's kind of confusing to read about how the advisory council operates. And so I said, hey, if you want to reword it, as long as it means the same thing, we can bring it forward and propose the rewording. So very minor tweaks like that is all that they're looking at. Realized that the next meeting is scheduled for election night. If you guys can give me feedback on if you want the advisory council to bring something to you in November, then I can try to reschedule that meeting. Otherwise, it'll be December before we can bring anything.
December's fine.
Okay, great. Then I will
Thank
not
you
worry about that.
for moving that.
Yeah. And then I shared with them about our very mild 2018 wildfire season. We had very few days, as you know, that even really got close to Saturday. A couple days did go over it in August. I think our most dramatic smoke came from the prescribed burn in Idaho that was just so unfortunately timed for when that smoke arrived here. So I was able to, I got information from the Idaho Nez Clear Forest, the National Forest, about what they did with that burn and what the fuels were and all the information we had about why it did what it did. The Nez Clear Forest tried to tell me it was wildfire smoke from California. I'm like, no, it wasn't.
Smells like Idaho.
But from the satellite pictures and from modeling and from people here looking at the plume coming at them, we are fairly confident in saying no, it was that fire that you started. So I was able to share the kind of story about that fire and why it was as bad as it was. And it really was just terrible, unfortunate timing. If it had come an hour earlier, it would have bounced out like it did in Frenchtown and come down and lifted back up. If it had come 2 hours later, it probably never would have mixed down. But it just came exactly when our atmosphere stopped mixing, and so we were stuck with it until the middle of the next morning. So it was
Soupy.
yeah, it wasn't good. It gave us 2 exceedances of the standard, and DEQ was working on talking to EPA about that. But it's one of the challenges that will always be with us with prescribed burning and smoke management. Sometimes we get it super right, and sometimes things go wrong. And when it does, there's always that concern of what it can mean. But we also managed to pull off a 600-acre burn 48 miles west of Missoula a few weeks later. So it's not like that spells the end for prescribed burning. It just highlights the challenge will always be with us and why smoke management is so important. And that was really the extent of our meeting.
Okay. Comments, questions? Any other public comments? Seeing none. Any other board or staff comments? And I guess on the agenda.
So the county has hired, and thank you, Sarah, for joining us. I guess it was it this week or last week? Like everybody else, I don't know when it was. Sometime recently. We
I started this
We meet with the
problem.
land managers group, but we hired someone to implement the community wildfire protection plan. So it's a joint hire, Forest Services paying for part of that, but to help look at the stuff that we have in the plan, and of course, smoke management will be discussed offline.
And just one other thing, I should put it under health board.
Max, that's as far as I can remember.
Excuse me. The health department was invited to join on the downtown master plan, the 10-year. And so Cindy Farr will be our representative on that, and that starts tonight.
Tonight at the Walnut.
Yep. Busy day.
Yeah, for sure. We have many things going on this evening. With that, we're
Thank
adjourned.
you. Okay, thank you. I feel like I have a barometric pressure problem.